أستغفر الله أستغفر الله أستغفر الله الله.
It would not be fair to ignore the certain types of blood vessels which we have not spoken of already. We spoke a lot about arteries and veins and big arteries and big veins and little arteries and little veins and arterioles. But what we have ignored are the two endpoints of the vascular system, namely the largest blood vessel of the body, called the heart, and the smallest blood vessels of the body, which are called capillaries. And whereas the heart follows the classical pattern of inner lining, middle lining, outer lining, with the blood vessels we call this intima, media, and adventitia. In the heart, it's called endocardium, myocardium, pericardium. And specifically, this is not just pericardium, but it's the part of the pericardium which is adherent to the heart itself, or the visceral pericardium, as composed to the more fibrous parietal pericardium, which is the bag, the fibrous bag in which this heart sits. But let's look at the three layers again. The heart, even though it's the largest blood vessel, once again would boil down to a single endothelial cell lining along its endocardial surface. And here's the connective tissue of the endocardium, and you could see these tiny, these tiny little cells towards the outside, right along the luminal surface, which are your single endothelial cells. So whether you are in a capillary or whether you're in a heart, the entire vascular system is lined by these flat endothelial cells. The rest of this connective tissue is the rest of the endocardium. 99.9% of the weight of the heart is the muscle itself, or the myocardium, which is classical cardiac muscle. But and it also has some connective tissue in between at various levels. You could see arteries within it, you could see veins within it. But the heart is also the myocardium is also a very excellent place to see capillaries as well. So whenever you are looking at individual myocardium and you see these little streams of red cells in individual lines, like here, perhaps even here, and certainly over here, and probably over here. These are individual capillaries, which are nothing more than endothelial line spaces. They don't have a muscular layer, and they don't have an adventitial layer. It's a single endothelial cell. But here we are now in the middle of the myocardium, in which we could see the striated but interwovenly connected muscle cells with central nuclei. We've already seen the endocardial aspect. So let's look at the outer aspect, which would correspond to the adventitia if this was a blood vessel, but because we are in the heart, it is called the pericardium, or more specifically, the visceral pericardium. And like adventitia, once again, it is very, very, very loose connective tissue and largely fat. And in addition, the very large arteries of the heart travel within this loose connective tissue layer. All of the major arteries of the heart travel in pericardial fat. So that's really all I want to say for cardiac muscle, which is the myocardium of the heart, and the epicardium, or visceral pericardium, would be considered to be the adventitia of the heart. And last but not least, this little layer of connective tissue here towards the lumen of the heart, which can differentiate into heart valves, is the endocardium. pericardium of the heart. And I thank you very much.
هاتنا واللي كفا ولنعاود من قريب ولنعد للنور صفا عهد ماضينا الأريب يا عسى الرحمن يهدي كل صبار منيب ويعيد الحب ينجي بالهدى قلب الحبيب يا عسى الرحمن يهدي كل صبار